Hi, it's Dr. Chris Pawlinga at We Grow Hair in New York, and today we're seeing our first patient in our new business. This comes in today for his suture removal, and what we like to do with patients who've had more than one procedure, we like to give it a good 2 weeks. We think the suture looks the best. You know, there were a few little minor concerns on suture line, and typically what we try to do is if we're going to do some suture line correction, we'll do it about a year after everything's all done, because if you attempt to modify something during the case, you can potentially make it a little bit worse. So I just want to introduce over here our lead surgical technician, Carol Marcello.
Hello.
Probably one of the best around. Carol and I worked at an outside facility for 12 years together, and we've decided to join forces and change people's lives. And we love what we do. So what we're going to do is the patient we have today is has a high profile in the community, so he's allowed us to do some videotaping above it, but to protect his anonymity, we're just going to shoot above the eyes, and we're not going to include him in any of the questioning. I'm just going to kind of give you a little bit of a walkthrough on what we've done. So the concern was to reinforce the front hairline here, and there was a real concern that when the hair just kind of you got into water, or sometimes this area, this right crease would open on up here. So what we really did is we tried to saturate this area and dense pack in this right crease here to improve the hair so things wouldn't open up on him. And I'm going to turn over here, and we came down on this side too. We just tried to pack in between the hairs that are already there. And the left crease, although concerned, nowhere near what it was here. And we finished up with putting some grafts in the back here. So what we found is that, and I'm going to turn over here and I'm going to show, as you can see, the suture line is right there, and that looks really, really, really beautiful. And today he's going to have that all removed. You see his little blue suture that come in here, and I'm going to turn just a little bit more to the right. Perfect. And as you can see, that's once the scars come out, you're not even going to be able to tell. My litmus test is, you know, if the hairdresser can't tell that it looks like that over after about 4 months, that's what we try to look at, so no one can tell. So as you can see, I just want to point one thing out too. We dense packed along this right, well, the front hairline and also the right crease, which is his most important concern, again, because things can open up. But as you can see, at 14 days, this looks pretty darn good. And he had used some vitamin E cream, which has been shown in some studies to help reduce or speed up the healing, and he used it very sparingly, and it looks really, really great. But you know, at 2 weeks, you can't even tell we were there. There's just a little pink tint on the recipient site, and that's normal. That's probably the last thing to go. But as you can see, it looks nice and clean. There's no scabs. There's no telltale signs. And we're talking 14 days, and this is what he looks like. You can walk around, no one can tell anything. So hair has 3 different life cycles, and I would tell our patient here that the trickiest part of hair restoration is it takes a while for the hairs to fully kind of grow out. But we'll be reaching out throughout the whole next 12 months. But I always like to wait till about 12 months to really kind of get a good look and see what we think about the hair growth. But we think we're going to have a really nice result right here. Every single patient may not have the same result as he does at 14 days. Sometimes some of the scabs might take a little bit longer. You might have a little bit of redness. But I think if, in general, if you do the proper care that we're going to instruct you to do, you keep it clean, you try to keep your fingers off it, you maybe use a little vitamin E cream sparingly, we would expect you can get a good result like this. And although results can vary within 14 days, sometimes, again, it might be a little scabbier, but this is what we typically would expect. And we think if you follow the protocol, it's going to look pretty close to this.